Welcome to the headquarters of the Catholic Health Association of India, Secunderabad, in the state of Andhra Pradesh. The love of Christ compels us is the motto of the Catholic Health Association of India, which has spread across the country with 3,300 member institutions and 11 regional headquarters. Friends, may I present to you this video which will explain to you the history, the legacy, the journey, as well as the work of the 3,300 member institutions in India.
Healthcare in modern-day India leaves much to be desired for. Much of it can be attributed to extreme poverty, illiteracy, low ratio of doctors, communicable diseases, and low budgetary allocations to the health sector. 60 years after independence, medical care is still out of reach of the common man. All this has created a need for a new healthcare system. A healthcare system that brings a change at every level of society, a change for the good. And this change is what we have been working to achieve for the last 65 years at the Catholic Health Association of India. The Catholic Health Association of India is an organized community of healthcare institutions and was founded by Sister Dr. Mary Glowry. Then known as the Catholic Hospitals Association, the organization was born on 29 July 1943 at Guntur in Andhra Pradesh. Those were the days of war, when need was great and supplies scarce. Starting with just over a dozen member institutions, the Catholic Hospitals Association worked amidst challenges to take the love of the Almighty among the masses, the sick, the aged, the wounded, and the poor. Taken in 1952, when the Community Health Insurance Scheme was started in Calcutta. Community health programs have made healthcare accessible to the poor and protected them from impoverishment and deaths arising out of medical expenses. In 1986, the central office, which was previously in Delhi, was shifted to Secunderabad, Andhra Pradesh, in order to balance the higher concentration of member institutions in the south. In 1993, the Catholic Hospitals Association became the Catholic Health Association of India. The period also saw the decentralization of CHAI. The decentralization process provided for an infrastructure that was not over-dependent on the center, where each regional center was linked to but not at the behest of another. This facilitated better local management and also to minimize impact of crisis. In 1957, Father James S. Tong was appointed the first director of CHAI. Numerous presidents and directors in the past 65 years have steered CHAI under their leadership to where it stands today. Father Sebastian took over in 2003. The PHC Enhancement Project started in collaboration with the Andhra Pradesh State AIDS Control Society, APSACS, Center for Disease Control, CDC, and Lepra Society has been a highly successful public-private partnership. Under this project, integrated counseling and testing centers have been set up at 266 centers across Andhra Pradesh.
And the PHCs are a wonderful opportunity because it's a government structure that's been set up really to accomplish that for all public health issues. And we thought, why not add HIV to the list of things that the PHCs are responsible for?
The nurse practitioners trained to test and counsel people are also involved in outreach work in the villages to spread awareness about prevention and management of HIV/AIDS.
The support of the government's been very good. You'll hear stories from the nurses, and I think their testaments are stronger than mine. But from my perspective, it's a challenge when it's a public-private partnership, and those things don't happen overnight. There's trust that has to develop. There's relationships that have to be built, and there's a division of labor that has to be negotiated. And those things take time, but I think the nurses have done a wonderful job, as well as the CHAI staff, of doing that.
A holistic realm consisting of physical, mental, social and spiritual well-being, and is practiced through two very important values, care and concern. Hence, treatment of a patient includes much more than medication.
Ways of counseling support, it's just not counseling, it's a kind of a very complicated emotional support system we have created, where patients are given full dignity.
Continuing medical education and capacity building has been a major focus of CHAI. We have facilitated the establishment and operation of many projects by enhancing the administrative and technical knowledge of the staff through training programs.
Probably the most important contribution CHAI made was capacity building of CHAI members. First of all, trying to work with their own stigma issues and their issues of not understanding how HIV is spreading and all. And then really empowering and helping them to start different programs.
At every step, we seek to innovate, to inspire and improvise. The Center for Excellence is one such initiative. The 100-bed hospital located at Medchal in Sikandrabad will be a nodal unit for all care and support centers, have clinical training facilities, and will be the state center for training and research on HIV/AIDS. Unfortunately, every now and then disasters occur. Some acts of God, like earthquakes, tsunami, flood, and drought, others man-made, such as displacement, war, communal violence, and each time huge numbers of innocents suffer. There is never dearth of those who need our help. CHAI has given all to help disaster victims provide relief and minimize harm.
Today, we are witnesses to a multiplication of that grain. Let us continue our journey till the last person cherishes the harvest.
In this video, you have been able to see the work of the Catholic Health Association of India, or CHAI. Friends, these are some of the places where I have personally worked, where I have experienced the struggles of the people. So may I request you to join me to forge an alliance which will enable the CHAI to bring health and healing to many. You can help us by establishing a medical fund for children, a medical fund for people who are affected with HIV/AIDS, TB and malaria. You can support us by adopting an HIV/AIDS care center. You can support us by adopting a member institution which works in the rural areas of our country. Your support can go a long way in educating nurse practitioners, hospital administrators, community health workers, and others in the field of health. So friends, this is my earnest request to all of you. Join hands with the Catholic Health Association of India and let us make a difference. May God bless all of you.